Hi, my name's Phil. I like talking about politics. And stepping aside from Brexit for a moment, just for a moment, and on to another situation causing excessive grief as a result of electing charlatans to government, I'd like to discuss the views of one of Britain's top medical researchers on why political leaders should not be using a COVID vaccine to build up false hope. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So we're now, over the last few days, seeing a very significant, huge, if anything, rise in the number of new cases in the UK. You know, a week after we've reopened schools and a few weeks after France saw a similar rise, mirroring the fact that we lagged behind France by a few weeks for the first wave. Nobody knows how to explain the situation. It's a complete mystery. But the real question is whether our second wave, or spike, or whatever you want to call it, will be better, worse than, or the same as France's. Now, Sir Jeremy Farrar, who advises the government, has been talking about our way out of COVID, looking to the future. Now, this was ahead of the sudden note of large increase in cases. He was saying this last week, but what he was saying was that a COVID vaccine will not be a silver bullet. He said that when a vaccine becomes available, and it is not at the moment, despite what Vladimir Putin says, it will need to be allocated where it is needed, not hoarded by the richest nations. Oh dear. And now he said in relation to UK use specifically, and I quote, "The first vaccine may not be a silver bullet that sends us back to normal in a matter of months, but by using doses wisely on people who most need them, along with truthful, considered public health messaging that does not place false expectations, we will be in a strong position to avoid a repeat of early 2020. Now, there are a couple of things I take from that. The first of which is the idea that the vaccine will not send us back to normal in a matter of months. And bear in mind, like I said, we do not yet have a vaccine. And nobody who would know is seriously suggesting that it is imminent. Yet, there is a widespread view, certainly in this country, not entirely sure about others, that we will be getting back to normal soon, with or without a vaccine. Too few people are even trying to adapt to a new normal, that works with COVID in our lives for the next couple of years or so. Because the government keep talking about returning to a pre-COVID way of life. The government are not trying to encourage us to change our way of living. They're actively dangling the carrot of returning back to normal, as if it is going to take place very, very soon. They're even trying to hasten that return by the use of threats and intimidation. And this mismatch between perception and reality is not helping anyone at all. The second point is, and this was the worst moment for me, was his second line. He said, by using doses wisely on people who most need them, along with truthful, considered public health messaging that does not place false expectations, we will be in a strong position to avoid a repeat of early 2020. So what he's saying is, and other health experts have backed this up in recent days as well, is that to avoid a repeat of early 2020, which you feel we absolutely need to, we need to do the following. Using doses wisely. Okay, so he needs our government to use doses wisely. This government that is closing down Public Health England in the middle of a pandemic. He says, considered public health messaging that does not place false expectations. Now, there's a couple of problems with that. One is that the public health messaging from ministers has, from the start, been confused, vague, and often contradictory. The other problem is that the government are actively seeking to give false hope when they want to distract from their mess. At the height of the crisis, Johnson kept talking about all the wonderful things that were coming that would ease the situation right off. None of it ever did come. And much of it was known at the time to not even be credible, but he pushed the idea anyway. The idea was to get people to focus on the next week, or can you get through the next week, or can you get through the next couple of weeks, which in theory is sort of okay, but he was promising things that were never going to materialise, which meant that public trust in the government kept ebbing away. And the problem now is, of course, if the trend of the last few days, and I'm always reluctant to just point to a few data points, just a few days worth, but because we are lagging behind France and because we saw what happened in France, you would think that in a few weeks' time this is going to look pretty horrendous. And at that point, the government again will promise what they're going to do, but they've already said that what we've put in place is going to stop us having the second wave. Boris Johnson and Matt Hancock are going to be reminded of those words, and then they're going to have to do something else to distract. And I have zero doubt at all that they will try, and they will get the media to try and plug the vaccine. Oh, that's looking promising. That's looking promising. Yes, it is. It is looking promising. Not for the next few weeks. Because avoiding scrutiny is his number one priority. They will make it impossible for the government to avoid false hope. This idea that we must avoid taking blame at all costs and we must avoid doing the right thing. False hope is what got them into power. False hope is the only thing keeping them in power. So Jeremy also talked about truthful messaging. Do I really even need to comment on that one? And we need to do all of those things to avoid a repeat of early 2020, he says. And as I said, other public health experts have been saying the same thing in the last few days with the news of the sudden increase in new cases. So where does that leave us? Well, we know the government won't do any of those things. We're tearing down Public Health England and replacing it with a privatised monstrosity run by a woman who has failed in every major project she has ever undertaken. Most recently, the government's tracing programme, which recorded its worst ever results last week, when you should expect such a programme to be continually improving with experience and strong leadership. It's we've also had the problems in recent days. People have been struggling to get tests. When people have tried to get to a local testing centre, they've been advised to travel hundreds of miles. Some people have been told to go on journeys up to 300 miles. Some part of the problem is that there aren't enough testing centres, but actually fundamentally it's the tracing programme itself keeps trying to work out distances from where you are as the crow flies. So sometimes it's saying, oh, there's a testing centre 20 miles away, which, by the way, if you're really ill with the temperature, is still a bit dodgy trying to get there. But it's 20 miles away. But then it turns out it's actually 175 miles away because to go 20 miles would require you to fly. Actually using the road takes a little bit longer. So it's an absolute mess. People are not able to get the test. And even when people are testing positive, the tracing system is not getting into contact with enough people that they've been in contact with, that they know they've been in contact with. And also, if you think about it, even if you supposed that what Public Health England is going to be replaced with would somehow be better, which is the opposite of what I suppose, then it can't be expected to be up and running seamlessly in a few weeks. In fact, we know it won't be. That is certain. We just know how these sorts of things work. It always takes a long time to build anything like this complex up, and you're always going to have teething problems for a while. That's with the competent handling. And the reason for this replacement, remember, is not because Public Health England isn't doing well enough. It's to reduce the amount of information the public have concerning healthcare. What we have is a government that want to stop people knowing how clueless they are. Their pursuit of secrecy is such a priority that they will actively allow a much worse crisis to emerge if only they can keep the worst of it secret. We've seen this during the pandemic, just like we've seen it during Brexit. There have also been reports of a leaked document saying that the centralised approach to COVID isn't working, that the national lockdown didn't do much to reduce infection rates in some parts of the north of England, which were lagging behind much of the rest of England, for example. So the focus in the news was on how this report highlights how the national picture can look stable, but that individual regions can be in the epidemic phase. This makes a nonsense of attempting national control. It has to be regional. But what it highlighted for me is, in addition to that, is the precise reason why the government are scrapping Public Health England. Because, this report was never supposed to be seen by the public, but the fact that it was down to the nature of the organisation. It's a little bit independent of government. They can't control it as much as they'd like to. A profit-first company replacing it will have no regard for information for the public. They will not carry out such studies because that's what the government want. That's why they are carrying out very few like reports into the impacts of Brexit, because if the report doesn't exist, it can't be leaked. And then that's the benefit of using private companies. This is why the data we have for testing is so poor, because most of the testing is now carried out by private companies, and there is no incentive for them to collect data that would be useful for research or to inform the public. The government do not ask them to provide this. That is one reason why it's so hard to get data on the number of people being tested. We do not know, and we haven't known for months. Most of that testing is carried out by private companies. You know, we can say, we'd like to know how many people are being tested. Would you? That's nice. Could you tell us? No. We're not contracted to supply that sort of information, so we don't bother collecting it. We can tell you how many test kits we've issued. Is that the same as the number of people tested? No. Is it even the same as the number of test kits used? No, because sometimes we send them out and they don't get used. Then what good would that figure be? Well, it makes the government look good to people who aren't paying attention. And that's what the abolition of Public Health England is all about. And remember, we're doing this not just in the middle of a pandemic, but specifically now we can see potentially, I'll give it a few weeks to see, at the start of what is very likely to be a second spike or wave, whatever you prefer. But there we go. Those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.